Lub-dub, lub-dub, lub-dub. The sound a heart makes when listened through a stethoscope. In almost every hospital or medical clinic you enter, you're sure to see nurses, doctors, and other medical professionals with a weird thing wrapped around their neck or stuffed in their pocket. This is a stethoscope, used for auscultating or listening to breath sounds, heart sounds, and bowel sounds. It's also used when the nurse wraps that cuff around your arm to take the blood pressure and pumps it full of air, and she listens for the blood flow to return to the artery. These simple conveniences that medical professionals use in crucial everyday assessments have not always been so readily available or easy to use. As a registered nurse for almost 1 year and enduring nursing school for 2 years prior, I have become very acquainted with and relying on the conveniences of the stethoscope, blood pressure cuff, and thermometer. There are many different medical devices used in a clinical setting, but I will just discuss a brief history and interesting facts about the following three: the stethoscope, blood pressure cuff, and the thermometer. According to the American Diagnostic Corporation website, a French doctor named René Théophile Hindsight-Lanique made the first stethoscope, and it was really just a rolled up piece of paper similar to a paper towel roll that he placed up to one ear and then up against his patient's back. He was pleasantly surprised that he could audibly and correctly hear the heart sounds. The first stethoscope was just a wooden tube with a circular screw and a circular base that was placed against an ear and then placed against the patient. In the year 1851, the stethoscope had its next major improvement, and it was made to be binaural, meaning it was used by both ears connected with two earpieces, like this photo here, which is the standard stethoscope design for all of them used to this day. Throughout the 20th century, many minor improvements were made to these devices that would reduce weight, improve acoustic quality, and filter out external noise to aid in the process of auscultation. The stethoscope is crucial for assessments because it allows nurses and doctors to listen to heart sounds, which are critical in diagnosing heart-related diseases. They use it to listen to lung sounds, which helps diagnose respiratory illnesses such as pneumonia and bronchitis. And then, as you can see on this stethoscope, there's a small end and a large end, and the diaphragms are used to listen to different high and low pitch sounds. The next medical device is the sphygmomanometer, which most people just know as the blood pressure cuff. And it was first blood pressure was measured in 1733 by Reverend Stephen Hales, and he actually, on a live horse, cut it open and placed a glass tube inside the horse's main heart artery, and measured as the pressure increases as the blood went through the tube. This was obviously too invasive for human patients, and in 1881, Samuel Siegfried Karl actually created the first blood pressure cuff that consisted of a rubber bulb that was filled with water, and as you squeeze the bulb, it would restrict flow in the artery, and then it would be calculated on a mercury column. The Museum of Healthcare website says that in 1896, Schiappone Riva Rocci made improvements to the current design of the blood pressure cuff that included a cuff that could be affixed around the arm to apply even pressure to the limb, and that would become the more standard design that we see throughout medical use today. The monitoring of blood pressure is important because if the patient's blood pressure gets too low, the body doesn't circulate enough blood quick enough, which impairs the oxygenation process to vital organs such as our brain, our lungs, and our skin, which is our major organ. But then if the blood pressure is too high, it puts the patient at much higher risk for health issues such as blood clots and strokes. The advancements of the blood pressure cuff have allowed for monitoring of blood pressure to be more convenient for patients. When patients are started on blood pressure medications, instead of having to come to the hospital daily to have their blood pressure taken in the morning and at night to make sure that their dosage of their medication is correct, they can take it at home with devices on the screen. They have electronic ones that wrap around the wrist and you just lay your arm flat and press a button. Or they have the more standard ones that are like a normal blood pressure cuff that wrap around the arm. And they're all electronic, so that all the patient has to do is take their blood pressure and record it and take it with them to the doctor, and then meds can be adjusted that way. The final medical device is the thermometer, and it was technically first invented by Galileo in 1593. It was more of a thermal probe. There was no number system, and his device could really only tell if the temp was rising or falling, and not to like a specific degree. In 1612, Santorio added a numerical scale to Galileo's current temperature, but there's no standardized method of measuring, so it was just really random numbers. And in 1714, Daniel Fahrenheit introduced us to the first mercury thermometer. So obviously you can tell by his last name, Fahrenheit, he is known for the Fahrenheit system that we use for all temperature monitoring. In 1867, Albert designed the first clinical thermometer. It was a portable thermometer. It was 6 inches in length, but it took 5 minutes to record the patient's temperature. So in critical situations, we don't really have 5 minutes to wait. And then in 1984, Freyden introduced us to the first infrared ear thermometer, which was just a different perspective. As you can see, thermometers have changed, and there's all different types. You can take temperature orally, which is by mouth, tympanically, which is ear, or they have ones that slide across the forehead, and then they have ones now that they don't even touch the patient, they just scan like a laser across the forehead and it measures their temperature. The World Health Organization tells us that the importance of monitoring the temperatures is crucial because high temperatures for a prolonged period of time can cause permanent damage, especially to the brain. So this is really important in like young children and old adults because they are susceptible to temperature changes more frequently and they can't bounce back as fast. The temperature fevers help indicate the severity of illnesses or infections. So they're used a lot in hospitals so we can monitor the effectiveness of antibiotics and certain medications. As you can see, these 3 medical devices are necessary for daily use for patient care, and without the advancements made, crucial assessments would be missed, and critical situations would take more time to establish our baseline of our patient. I hope that this presentation has presented you all with some useful information and history on the stethoscope, blood pressure cuff, and thermometer. And I thank you all for taking the time to listen. The next time you visit the doctor's office or hospital, maybe you'll think about where the medical devices first began.